Hello, everyone. We already were introduced. Before getting into the nitty-gritty of everything, I would like to introduce those that will speak. Just a few facts, because you know that the agency relies on evidence. Every year, 40,000 deaths related to air pollution. Summer 2023, 5,000 deaths due to heat. That's just the beginning. It's quite gloomy, but there it goes. As for the land use, we know that soil degradation, urban use will entail 30% of emerging infectious diseases, EIDs. We can have two options. We can, be passive or be proactive. And that means not only working on health-related issues, but also on the environment, on air pollution, on climate, with temperature, on the quality of land and soil, so that the quality of our actions could entail benefits for the scopes of activity, but also co-benefits for the protection of the population at large. Drawing upon these observations that are quite gloomy, these are also arguments to develop advocacy arguments to facilitate, speed up policies aiming at facilitating, speeding up, and mitigating these actions, these patterns in an intersectorial manner. Of course, many were related also to the pandemic at first, but we were made aware of the situation much before that. I thank you for your attendance today. I know that there are many people online who are also in attendance. The aim is together to see what is at stake in terms of public health and environment. We know that it is a necessity to face global changes that we are faced with. We'll have first a discussion with three speakers to set up the scene on climatic issues, but also we'll talk about biodiversity, because we know that it is important and it seems far away from us. However, it is very important. And someone from the AMS, Sinaya, will talk about will talk about what is at stake and the impact that it can have. Then we'll have some discussions. There will not be a Q&A after each speech, but we want to make sure that all the speakers can speak between each other, and we'll try to unblock the silos between each of them. Alain Sandoz, Laetitia Huard will also speak together, and once we've set up the scene, we will be able to think about the concepts and move further how we can roll out these concepts with concrete cases, with nature-based solutions that will favor the environment, but also health, and to see how the agency, including Santé Publique France and INSES, can organize themselves together to face these issues. I'm going to give the floor to Sylvie, who will be the moderator for the first part of the session. Sylvie, you have the floor. Thank you, Sébastien. Hello to everyone. I'm delighted to welcome you for this session. And without much further ado, we will tackle the first part of this session. As Sébastien said earlier, is rather related to the presentation of what is at stake before getting further into details. The first ice-breaking session will be Laurent Bopp, and I'm going to ask him to join us to make his presentation. Laurent Bopp. Laurent Bopp is the Director of Research at the CNRS, the Lab of Science of Climate and Environment of IPSL, and he's a member of the IPCC. He will make a presentation on climate change, the state of play, forecasts, and the main risks that we're about to face. The floor is yours, as we say in good French. Hello, thank you for your invitation. My role is to set the scene, to talk about climate change. In everyone's mind, we're all struck by some events related to climate change that occurred. So I'm going to give you an overview of what has happened and insist upon the main risks that we will have to face, but also solutions, mitigation solutions, how we can curb or do something with climate change. And we'll talk about the other solutions looking ahead. In the introduction, we talked about summer 2023 and the effects of important heat on mortality, including in France. You will remember this heat wave in Spain with temperatures rising up to 46 degrees Celsius. Heat waves in India also with temperatures that could exceed 50 degrees Celsius. And human populations are obviously strongly affected by these heat waves, which the frequency of which speed up and occur more and more. We also have other extreme events that are related to human-based events. There's one in 2023 that we lived worldwide. There's rainfall, heavy rainfall, with an impact on infrastructures in Greece. You remember also the north of France when we had floods. And then also, still talking about water, we had floods and extreme rainfall. The other extreme event is extended drought, frequent drought, intense drought, with the impact being forest fires that we saw in the far north of Canada. Everything was attributed to humans and climate change due to human action. So, with a bit of hindsight, I'm going to show you the evolution of global surface temperatures. The situation is not good, obviously. You can see the rising of temperatures. These are actually the anomalies of temperatures since 1850. We start in 1850. That's the starting point. This is where we start having enough data to have the averages that we need. And this shows the climate change and the effect on temperature and the record that was beaten in 2023 with a temperature that is much, much hotter than we ever have had in the past. And that's since 1850. Three elements that seem important to me in terms of temperature rising. First, the fact that it's unprecedented when we compare this recent rising with what we've built over the last 1,000 years. This is what you can see, the reconstruction of temperature. We can see that this rapid rising of temperature is actually unprecedented over the last 1,000 years, 100 years, even beyond 1,000 years. And when we talk about the causes, an important element that was mentioned in the IPCC report, they said that this increase of 1.1 degree Celsius increase is due to human action, and 100% exclusively 100% of this increase is due to human action. It's not the sun. We can have over 10 years some evolutions due to the sun, but 100% of global warming is due to human action. That's what was said in the IPCC report. And there's a heterogeneous impact. Some would rise higher. In some places, the temperature rises more than others. In France, that would be 1 degree. That would correspond to 1.7 or 1.8 in France. So actually the global warming is more impacting on France than in other places. So we can see that continental and sea ice continue to melt. This is the sea cover at sea. We've lost half of our ice in the poles. This is an increase of sea levels of 20 centimeters due to the warming of the sea and the overall factors. This is all the variables that change today, and that impacts human society and ecosystems. I'll talk about it later. I'll go back to extreme events that are definitely at the heart of climate science. This is what impacts us more. And you have the latest IPCC report where we see that in some regions of the world, we see an increase of frequency of events such as extreme heat, extreme rainfall, extreme drought. And we can attribute the increase of frequency of these events due to human action. And so that's important because we can make a direct connection between some weather extreme events and human action, exclusively done by the human action. So 1 degree, 2 degrees were not far from the objectives that were set during COP21 in Paris. We're getting close dangerously. You can see the curve of temperature. And if we reach 1.5 and 2%, well, the political will is to try to draw attention to that so that we don't exceed the thresholds that were set up during the COP21. So a few words on forecasts. Where are we going? This is a graph from the IPCC report that shows you the forecasts for 100 years. In the lower right-hand side, you can see where the emissions continue to grow until the end of the 21st century. And in light blue or dark blue, you can see scenarios where we can mitigate climate change and emissions to reach a zero or to be even negative. And you can see the response from the environment with this. Obviously, the conclusion is that the future emissions will have an impact on global warming, and we could have 4 to 5 degrees of additional temperature as compared with the Paris Agreement. If we have 1 or 2 degrees, we need the emissions to decrease significantly or to be negative in terms of emissions. That's the challenge that we're facing if we want to curb global warming. The increase of temperature at the global level up to 3 degrees, or if we can limit the emissions and make them decrease to 1.5 degrees, they would express themselves at the regional level in a mitigated way, in a contrasted way. When you have 2-3% of temperature increase, you'll have regions that will have an increase of temperature that will be much higher. In the Arctic region, that will be much more. In France as well, the temperature increases more swiftly. When we talk about 3 degrees of temperature increase, that would correspond to 4 degrees in France. This is why we need climate adaptation measures to adjust to this change of temperature. A side event to that is also rainfall at the global level. And we have effects that are different from one region to have. So the water cycle changes with more rainfall where there's already a lot of rainfall at the equatorial level, but also there's less rainfall in the tropical areas, such as around the Mediterranean region, where we have an important drop in rainfall. And with this amplification of rainwater cycles, that will have an impact everywhere, even where we have less rain. Well, when there's rain, we'll have much more rain all of a sudden. And so the main climatic risks that we might have These are the forecasts that were set out. There are 4 of them. It's actually an outline. On the left-hand side, you can see the thermal stress related to exposure to heat that will increase with 1.5, 2 degrees of temperature increase. And risks related to the modification of water cycles will have also water shortage. Water resources depend on ice melting, and in some regions, an increase of temperature of 2 degrees will entail less water resource availability. The third risk is food safety. This would be detrimental to cultures, to cattle raising, to fisheries. And the last risk is floods with extreme rainfall, as mentioned earlier, in the north of France or in Greece, as I said in my introduction, but there may be also be some floods along the coasts, along the sea, as I said. A few details on these important risks. You have important graphs in the IPCC report at the regional level, at the global level, in all sectors of activity that are in connection with human population. A few maps on the loss of biodiversity with 1.5, 2 degrees of increase of temperature up to 4 degrees. We can see with the modification of the climatic characteristics, it can have an important impact on biodiversity. Philippe Grandcola will talk about it. That's not the only factor that will impact biodiversity, but in the future, looking forward, this climate change will definitely be an important factor that will be heavy, that will take its toll on human population and biodiversity. You have a mortality risk on human health related to the increase of temperature in the tropical regions, especially. We could have 300 days a year where temperature and humidity of the air could have an important impact on human population. So we need to adjust and we need to mitigate to make sure that we stay alive on this world. I will wrap up with these risks at the regional level with mention of risks that would weigh upon food systems, may it be for culture, for crops, for corn, or fisheries. You can see that we should expect a yield drop for corn and fisheries due to the increase of temperature. Here you can see the word where we have 3 degrees of increased temperature. We would have fish resources that would drop by 50%, and the ocean systems which change drastically as well. So the impact is very significant. It is already there and already present today. Then I didn't talk about the sea level rise. We should expect 1 meter in 2100. There are a lot of other risks that could come up as a corollary. If we decrease the emissions and the temperature rise, then we could stabilize the ocean systems. But sea level rise is a slow pattern, and even if we stabilize temperature at 1 degree or 2 degrees, the sea level will rise over 100 years. And when we think about adjustment and adaptation and diminution of risks, we have to think long term. In the IPCC report, you would find different chapters, some chapters dedicated to crops, to water. Everything is described in details. And I would urge you to read human health, the human health chapter. And a lot is described on the adaptation with the co-benefits of sustainable development. These adaptation solutions are doable, are feasible. Some of them are efficient. They offer a lot of additional advantages. However, there's a lot of challenges because they would lose in efficiency over the long term if we are in a world that is hotter tomorrow, it may no longer be as efficient as before. Financial resources may be insufficient. And in some cases, there are risks of misadaptation, bad solutions that could have a harmful effect on human health, on biodiversity, and we have to be cautious about this. There's a lot of big challenges for the years forward, and I know you're going to talk about it afterwards, after me. Last point on mitigation before wrapping up, to remind you that we are not in a pathway that would limit the temperature rise to 1.5. We're still on a pathway where emissions continue to grow. You see 1990 to now, that's 500 million tons of gases that are being emitted, all combined. We haven't reached a plateau yet, and we are not in a curve whereby gases are emitted less, and we're not going down in any way. So the IPCC report is important because we see the carbon gases that will continue to be emitted. We still have 500 billion tons of CO2s. That means that's less than 10 years. We have only 10 years left. If we cannot curb gas emissions, that's the challenge ahead. We need to curb quickly emissions of greenhouse gases if we want to curb climate change. These are the emissions this is where we should stand if we wanted to limit at 1.5 or 2 degrees the rise of temperature. We're no longer in a trajectory where we continue to increase strongly. We are going towards a plateau, but this isn't enough to curb climate change. Each year counts, and this is why we have to work also on adjustment and adaptation. Thank you. These are the references on most of the figures that I showed you. The IPCC report was published in 2021-2022, and then there's also the Conference on Climate in France, which talks about mitigation but also adaptation, and that will be interesting to think about the evolution and the forecasts ahead of us.
Merci beaucoup, Laurent Bopp. Vous restez avec nous.
Thank you very much, Laurent Bopp. Please stick around for the Q&A that will take place just after the presentations. We are now going to be joined by Philippe Grandcolat, who's going to give us a presentation on the links between biodiversity and human health.
Philippe Grandcolat, qui est directeur de recherche au CNRS.
Mr. Grandcolat is research director at the National Center for Scientific Research. He's an ecologist and an evolution biologist. You have the floor, sir. Thank you very much for your invitation. Good morning, everybody. I'd like first of all to talk about the concept of biodiversity because it's not that obvious in our usual representations and like climate that everybody's familiar with. Biodiversity is something which is kind of unresearched or unthought of. We have there are words that we use in everyday language, but a term had to be coined in the 1980s by the scientific community, and since then it's been enshrined in conventions to protect biodiversity. But we need, so of course this is something which is common to all living organisms, etc. But it's very important to remember that throughout evolution, organisms have differentiated, and today we have organisms like those you can see on screen in our environment, and human beings are part of this ecosystem, and of course we cannot be indifferent to the rest of the living world. Also, it's quite surprising that in our cultural representations and also in the scientific community, we are sometimes deceived by our senses. For example, if my grandparents had studied sciences in the early 20th century, they couldn't have learned microbiology, evolution, etc., because these subjects were in intellectual gestation, so to speak, and they were not part of the cultural foundations of the time. These are not representations that were passed down to us by our parents and grandparents. Now, of course, by definition, you cannot see microbes because they are microscopic. There are many interactions between organisms, so it's very difficult to see these interactions. For example, if you can see a bee on a flower, but you can't see, for example, the effects of vector-borne diseases or the interactions between mushrooms and trees in our ecosystems. And last, it's very difficult to be aware of demographic changes because these are trends that occur over a very, very long period of time that are very slow. So unfortunately, we can't see this. There are also intrinsic behavioral biases. Here is the picture of this dog reaching to his master. When you see this, you want to pet the dog. So we have this empathy. We have a lot of empathy for mammals, though, who we pay attention to. We have empathy for all the vertebrates, but not so much. And we have absolutely no empathy for other categories of organisms that are far from us. So every day we make decisions whereby we differentiate between between mammals, for example, and fish stocks in oceans. So there's a difference in empathy, and it also influences the scientific community. Look at this chart on the right-hand side. It's based on 600 million of biodiversity-related data, and it shows that we under-research and under-assess some species, but we over-research other species. And we are oblivious to the fact that many insect species give us many services. So we have intrinsic behavioral biases, and we can see the origins of that in cultural representations. We can see this in symposiums amongst field biologists, and of course it influences our relations with stakeholders in society. Now, the problem of all these biases is that this leads to a biodiversity crisis. Unfortunately, it's similar to the climate one. There's often reference to the sixth biodiversity crisis in reference to the five previous crises. We were not there at the time. But like for the current climate crisis, we can say today on the basis of figures that extinction rates are mostly caused by human activity. Now, a diagnosis of this crisis was proposed by the IPBES, which it convened in Paris in 2019. And this assessment showed, on the basis of approximately 15,000 scientific publications, that there were five main causes for the disappearance of species. The loss of habitats, of course, if you cut forests. Extractions of natural resources, for example, 30% of fish stocks are currently over-harvested. Climate change, which affects biodiversity, as my colleague has just showed. Climate change affects seaweeds and oceans, for example, that are less and less able to trap CO2 emissions. Pollutions, of course, which lead to considerable environmental debt. Today, we have more than 100,000 of synthetic chemical molecules that affect the environment. And the last strain on biodiversity is species. Today, there are species that have been relocated by human beings because of human transports. Let's not forget that air travel has increased by 1,000% in the last decades, and this relocates some species that are particularly problematic for human health, like the mosquito tiger here on the slide. Now, this is not only an ethical issue. When you talk to high school students, you can tell them that some species that we thought are familiar, like for example African species that you can see in the media, will be gone when they reach the age of 60. But also, we need to become aware of the functional consequences of biodiversity loss. Here are a few examples. First, in terms of food output, we saw earlier on the consequences of climate change, but it's the same with biodiversity loss. When you, for example, when you look at the way we treat soils, in the soil are a lot of bacteria that are part of the food chain. Well, if we pollute or erode these soils, for example, with agricultural inputs and other factors, soils are made unable to yield any food. Today, 40% of arable soils on the surface of the earth are strongly deteriorated, including in mainland France, where this figure reaches up to 25%. Of course, there's also the loss of pollinators, of beneficial species, the genetic erosion of varieties, a pathogen virulence evolution, all of this due to pesticides, amongst others. So this is really affecting the yields of agricultural production. Also, in terms of water, we often tend to think in our common cultural representations that the water is only the water you can see with rain or in oceans and rivers, but water is also green water, the water contained in soils. Now, of course, when you cut plants and trees, green water is no longer available, or conversely, there might be too much of it, and we will start to run off. So this raises questions in terms of water availability. 1/4 and soon 2/3 of human beings will suffer from water stress. And of course, climate change is one of the main drivers. One last functional consequence of this decline in biodiversity is the emergence of diseases on a very large scale in the last years. And we're actually going to look at a specific example here, the Ebola fever. When you fragment the environment, tropical forests or natural environments where you settle pioneers, human populations, you exponentially promote interactions between human beings and animals that may be hosts to pathogens. For example, some work has demonstrated that in West Africa, outbreaks of Ebola fever were due to the presence or the installation of human settlements in the vicinity of some reservoirs or hosts of pathogens. So if you fragment habitats, you increase the number of interactions with pathogens, which leads to the emergence of diseases as pathogens adapt to the human species. There are other issues. We've just talked here about the extinction of habitats. The second cause is extractions of natural resources. In Europe, a lot of foxes are killed. So, for example, each year, nearly 50,000 foxes are killed in France, but it's not really based on a rational approach. And unfortunately, these foxes are the main means to control rodents. So they actually prevent rodents from transmitting the Lyme disease. So our attempts to regulate fox populations are not designed in consideration of the risk of the Lyme disease transmission, which could be an issue in the years ahead. Another source of pressure on biodiversity is the emergence of exotic species. They crowd out some local species, which unfortunately today, and unfortunately these species have terrible effects on the human population. For example, scientists have completely underrated the dynamics of mosquito tigers that have arrived from Eastern Asia and which in a few decades have managed to spread across most of mainland France. And this spread was facilitated by two counterintuitive drivers, which actually were decisive. The fact that its eggs can undergo diapause and withstand drought, And also you have larval habitats, which for most of them are artificial substrates. So these are not species that thrive in wet environments, but actually that do thrive in urban environments. Now, let's talk about pollutions. If you're not an ecotoxicologist, you usually regard pollutions as an exposure that would only depend on the level of pollutants in an amorphous environment. So there's been famous work on DDT, which shows that it's not the case. In food chains, there are amplifications at each link of the chain, and also the chemical quality of these substances can be expanded due to the combination with lipophilic pollutants, for example. And we found that today similar mechanisms operate in relation with PFAS in link with their proteins. Some of these substances were detected in seabirds, for example. So here again, you can see that our exposure to pollution also depends on mechanisms that operate in ecosystems. Also, all organisms that we've just mentioned evolve with each generation. For example, the tiger mosquito that you find in Greater Paris today is not the same as the one that was introduced a few decades ago. And we also have a very good example here, the I5N1 avian flu virus. The first one appeared in an Indian farm, and its virulence has been exacerbated as it was transmitted in industrial poultry farms. In these farms, animals live very close to each other. And unfortunately, this virus has affected wild birds in their tens of thousands. And then marine mammals that lived alongside of seabird colonies. And more recently, this virus has been transmitted to dairy cows in America. So this may have serious consequences for human health, but also for biodiversity. And we need to understand that biodiversity constantly evolves. Now, unfortunately, all this doesn't lead to any solutions. There's no silver bullet to solve the biodiversity crisis or to improve our relations with it. Of course, we need to ease the different strains and pressures that I've mentioned. It's an absolute must if we want to end this extinction crisis and the functional impairments that result from it. But also, we must also ensure that we always strive to strike the optimal balance. I suppose this will be taken up by my colleagues in a much more expert way in the following presentations, but I think we need to understand that it's essential to green cities for climate grounds, but also for people's well-being. But at the same time, we cannot give a free rein to biodiversity. We need to manage this greening process, and this leads to a number of methodological issues and potential costs that we need to factor in. In conclusion, I think it's very important to reclaim the dynamics of biodiversity. It is essential for food, for water resources, etc. And actually, the IPBES will be publishing in December this year a report on this specific nexus between biodiversity and all the components of biodiversity. Biodiversity can harm us if we don't comply with the right stewardship rules, with the right rules of management. Biodiversity is essential, but we need to remember that there may not be any quick win or easy solutions. We need to manage biodiversity with all stakeholders in society at large. And more importantly, we need to remember that biodiversity has interactions. You cannot reduce the number of Lyme diseases if we only focus on ticks and if we don't look at the hosts for this bacteria. We also need to be mindful that, for example, if we extract the wrong age group in a species, this may lead to the spread of viruses. And it's the same for mosquito tigers and H5N1. Thank you very much for your attention.
Merci beaucoup.
Thank you very much, Philippe Grandcola, for these explanations about biodiversity and the consequences for human health. We are now going to listen to a presentation by Sinaya Netanyahu. He's going to join us on stage.
Madame Netanyahu est responsable du programme Évaluation de l'impact sur l'environnement et la santé.
Mrs. Netanyahu is in charge of, so works at the European Office of the WHO. Her presentation is going to be in English. So for those of you who need translation, I think we have headsets available in the auditorium.
Good morning, and thank you very much. Thanks a lot for inviting me to this meeting. But also I want to congratulate Public Health France for really bringing this topic. I do not take it for granted because we work with 53 member states in the European region, from the European Union to Central Asia to the Balkan. And unfortunately, we are still pushing the issues related to climate and biodiversity forward because the talk around is much about pollution, and only recently people are realizing the impacts of climate change and bringing it to the table. But unfortunately, biodiversity is still lagging behind, and we wonder why, because actually we had the pandemic, and the pandemic had gave us a boost to understand the interlinkages, but still, when you go and check with many ministries of health, if public health, if they deal with that, the answer is oftentimes not. And also, what's I think worries is that, because what was demonstrated today, that is also much interlinked, with agriculture, with environment, with health, with our economy, with energy production, etc. And the question: are we working together? Are we breaking the silos? Are we reaching out to each other? We each need to do whatever we do. I mean, I'm not saying that an agronomist or a veterinarian needs to be a public health person, but we do need to understand the interaction, collaborate, and discuss the implications. I would like to take the opportunity also to introduce the office that I'm working in WHO. It's also cannot be taken for granted that WHO devotes quite a bit of attention to environment and health. As you know, 15% of premature mortality in the European region, in the entire WHO European region, is attributed to exposure of pollution, but it does not account the implications of communicable diseases in relation to issues related to biodiversities, and it does not account for climate change yet, so the numbers are on the rise. Our center exists from 1989, and we get the mandates from a ministerial conference on environment and health, and with that, the very unique things that we have is, as a UN organization, is our convening power. So again, we have this tremendous ability to bring together ministries of health and environment, and you have to take my word for this. So oftentimes, we see in our meetings that the ministries, people from both ministries, the first time they will meet each other is in our meetings. They would not know each other from their own countries. So I do not take it lightly that this convening power can serve. We provide member states with state-of-the-art evidence on existing and emerging environmental health risks. We develop policies, advice, and international and regional guidelines. For example, the air quality guidelines, even though it's a global, it is done in our office. Also the noise guidelines, the European one, was done in our office. We also develop methods, we develop tools, and we inform and support decision-making in government, upon requests coming from those governments. We assist member states also in identifying and implementing policies to protect and promote health, and we support member states to walk the talk and really to implement commitment on environment and health. The mandate was given, as I said, since 1989 in the first ministerial conference. Since then, we had several ministerial conferences. The last one, which your office was also was presented by Sebastian, was in 2023 in Budapest. But what's really interesting is that if until 2017 in Ostrava, member states have requested us to support them in a very silo way, mostly on issues related to pollution, like water, chemicals, air pollution, etc. And in Ostrava, they added climate change. This story of working in silo is gone. And it was gone in Budapest because Budapest made a huge change to bring also biodiversity. But before I get to that, when we were preparing for that, we said, okay, we need to reach 2030 with the SDG, etc. But what are we facing? We are basically facing the triple crisis, as we all know, which includes the three elements of climate change, biodiversity loss, habitat fragmentation and loss, ecosystem failures, land use change, and overexploitation of natural resources. And the third thing is environmental pollution. And in addition to that, we have urbanization. So it was clear to us that we are going to tackle the triple crisis, but not just each crisis by itself, but also try to understand the interdependencies with that crisis in relation to this crisis. Now, this brings me to another element that I would like also to discuss towards the end of my talk. Are we fit? Are we ready to deal with this? Do we have the right people in our ministries to deal with those issues? Do we need to change our professional profiles, competencies, etc.? But at the same time, we're also living in a changing society where we have population growth. In Europe, it's mostly related also to immigration. There is a demographic change, of course, population mobility, rising demands for energy and resources, ongoing patterns of consumption. We keep this SDG of consumption and production, sustainable consumption and production is still a major challenge for us. We consume a lot, we dispose a lot, and that takes resources from the environment, destroy land, destroy natural resources, and give us back lots of pollution. There are lots of trade interdependencies. We saw the extreme of it during COVID, and we have also tourism. But I want to raise another aspect. We also have issues related to inequality and injustice. And that's also something that we had in mind before the last ministerial conference in Budapest. And this is unequal exposure to environmental risks. Some people are exposed more because they would live by a river or by a stream or by the coastal area or by a landfill or any other contaminated site. But we also have unequal distribution or access to health promoting natural environment and resources. Not all of us live next to a nice green space. Some people do not. And then, we need to consider that as well. And there are obviously other elements, as you can imagine, related to this. But that's three things: the environmental changes, the social changes, inequality and injustice. We had it in mind, and we wanted to see how we are going to influence what's happening in the entire place. And why is it important to look at the 53 member states and not specifically in one state? Because many of the issues that my colleagues described this morning are global, they are interregionals, and disease in one place may cross boundaries. Mosquitoes or other diseases do not know boundaries. So it's very important that we as a continent will be on the same page. It would be better if globally we'll be on the same page, but at least our continent. So we brought together the triple crisis and to see what health is related to that. But we also, this Budapest meeting was a good opportunity to recap what we have gained and what we have learned. What knowledge we have gained and learned after COVID-19. We also focused in the Budapest meeting on environment and health in addition to tackling the triple crisis, we wanted to build forward to see how we can create urban resilience that also included, green space and tackling, climate-friendly cities, etc., but also protect the vulnerable. So the conference itself has resulted with the Budapest Declaration, which you can Google it and read it. So it is a declaration, but what's also important is the annex that looks on particular issues that we can do in those issues, including some cross-cutting elements. But when we look at the WHO, in general, from headquarters, because you would be asking how we manage it globally, we do have a global strategy on health, environment, and climate change, where we are aiming at primary prevention. Cross-sectoral action is very well emphasized, because we tend to think WHO, we work only with ministries of health. No, we need to reach out to other ministries. We need to work together, and this is our message to member states: break the silos, talk to your colleagues in other ministries, because it's all interlinked. We also know that we need to strengthen the health sector, build support, enhance evidence and communication, and monitoring. And communication is also very, very important, how we communicate it with these different stakeholders, and not frightening people, because it's sometimes paralyzing, especially the youth. They are paralyzed when we talk to them about these extinctions related to climate change, to biodiversity and issues related to climate change. And since we want them to be on board with us, because they will be our next generation's leader, we need also to make sure that we also do not affect their mental health. We need to make sure that we communicate without creating a fear, but also communicating the science and translating the knowledge and the science in a coherent way. When it comes to the time of COVID, headquarters of WHO came up immediately with the manifesto for health recovery from COVID, and with six prescriptions. And I want to mention the first one. The first one was protect nature. And again, WHO is not the Convention for Biological Diversity. We are not UNEP, but nevertheless, the understanding that to protect nature is the number one message was very, very clear from the pandemic, and there were some other interrelated, obviously, prescriptions. In 2015, about 10 years ago, that was the first, I believe it was the first time the WHO worked together in a systematic way with the CBD, the Convention for Biological Diversity, and came up with this publication, which I would not discuss much, but again, they brought the issues of biodiversity losses happening at an unprecedented rate, and it creates also issue related to health, especially pandemics, epidemics, and infectious disease, etc. But it also looked at the benefits that we can all gain from that, and they also encouraged the scientific community to keep going, to keep looking at the interactions and the interlinkages between biodiversity and health and human health. In the Bonn Center, in the European Center for Environmental and Health, where I'm from, we also concentrate in the recent years on different angles and aspects. When it comes to green space and blue space, we were working specifically on green space in cities, and we have a brief action, because we are not just looking at the public health people, but we are looking to make an impact on planners. Because if we are talking, and my colleagues mentioned that we need to look at land planning, land degradation, etc., we need to remember the spatial planners. We need to bring this to their attention as well, and they are part of our stakeholders. So this is directed for them, like bridging between the health and the environment and planning. We also had a literature review. We also wanted to look at the economics of that. My colleague mentioned greening cities. Okay, but mayors would like to know, what does it cost? And so we brought together the co-benefits. It's not just biodiversity, it's also health, mental health, it's physical activities, etc. And when you get together all those co-benefits and assess them in a monetary way, you can also present a very interesting case that will also fit economically. economically. We also looked at green space and in mental health. And I want also to pay attention to another two publications. One is the Nature and Biodiversity in Health, and I believe that we translated it to more than 10 languages, might be also included in French. And this is also really to be able to disentangle and to understand and to display the interconnection between nature, biodiversity, and health. And we took an ecosystem approach there, ecosystem services approach, I will mention it, but it was very important for us to bring it because to communicate in a simple language, complex issues with lots of uncertainties, but still be humble and try to communicate it in a simple language. And the next publication was about One Health, which I'll also mention now. So this report on the nature and biodiversity, which I briefly demonstrate, we looked at the ways that nature, biodiversity, and ecosystems can support and protect health and well-being. So it's not just a communicable and infectious diseases, but it's also mental health, but also how environmental change, degradation of nature and ecosystem and biodiversity loss can threaten human health. We looked at those issues, the fresh waters, air quality, the marine environment, soil and agriculture and nutrition and food security, infectious diseases, microbes in the environment, and also on medicines and healthcare, and also access to nature. So those are our topics that we will look at. We obviously looked, and I would not have time now to elaborate too much on this, but we took the ecosystem services framework approach, where we kind of looked at the supporting services, the provisional services, the regulating services, and the cultural services that we as human beings obtain from the environment. It's very important to know what we are talking about. So for the scientific community, it's very clear, but for practitioners and also for the public and for planners, it's not always very clear. And we need to take the extra mile to elaborate and explain how it's all connected. For each of those things, we looked at how nature is vital to support, is a vital support system for human health. We looked at how it contributes to our quality of life, how it protects our health, and also we also explain and outline how failure to protect nature threatens health and well-being. For example, if we looked, I just picked up one example in medicine and healthcare. We remind ourselves that biodiversity is essential for provision of pharmaceuticals and healthcare. Around 1/3 of modern pharmaceuticals have been directly derived from compounds found in natural world, and many other drugs are designed to mimic natural products. Greater biodiversity in natural ecosystems increases the chance to find natural compounds that could have medical use. So this is just one example, but it goes and to more elaborate and more extent to explain each of those topics. I now want to move quickly to One Health. There is a lot of misconception, unfortunately, and I'm just coming from a quadripartite. The quadripartite, in parentheses, is a collaboration between WHO, UNEP, FAO, and WOA, the World Organization for Animals Health. And we collaborate in recent years, where recently also UNEP has joined us at the global level, but also we have a quadripartite at the regional level. And we work together towards One Health. One Health is an approach. It's not a science by itself. It's not a discipline by itself. It's an approach to integrate, unifying approach that aims to sustainably balance, not maximize, balance and optimize, not maximize, the health of people, animals, and ecosystems. So if until now we talked about the complexities that we have as a triple crisis, climate change, biodiversity, pollution. Now we are adding another thing. We are adding the interaction between animals, human health, and environmental health. And I'm bringing this example for two reasons. I'm bringing this example to show you how for many years, everybody was very happy to deal with One Health only with human health and animals' health, and the environment was not considered whatsoever. And I'm bringing it for another reason, is because this is a great example how the silos must be broken and how we need to revisit and look also at our professional profiles. So when we started looking at this work, and again, for sake of time, I will not go very deep I started looking at that because I was curious, and I found that the component of the environment in One Health was largely overlooked. It was neglected. Until 2021, there weren't many reports trying to conceptualize what is the role of the environment, and more important, or not less importantly, is what is the impact of the triple crisis and how it can accelerate issues. Because when you have intensive economic activities, such as, for example, livestock production, there's issues related to pollution, issues related to land change use, issues related to antibiotics that are oftentimes overused or misused, not necessarily, I'm saying in this country, but in the region. Remember the region, and we are all in one region, it's all interconnected. So all those interlinkages are not, were not clarified when it came to food safety and understanding the climate change effect. Those issues are not there, yet One Health usually concentrate on tropical diseases, on AMR issues, on zoonotic diseases in general, and also on food safety. But all of them were just, working together, hopefully in most places, both sectors, agriculture and health, and human health, but neglecting the environment. So we were trying to look at the role of the environment, but also we looked at the environmental stressors. And I'd like to know how many more minutes do I have, because I'm sure I cannot go much.
Not much.
Not too many.
But you are welcome to at least go up till the end, of course.
Okay, I would just give a couple of slides related to that. We have a rise in emerging infectious diseases outbreak. 60% of the emerging infectious diseases are zoonotic, 75 of them related to wildlife. Now, I mentioned livestock, I mentioned agriculture, but who is taking care of wildlife? I mean, where does it fall? Is it in some country? It's attached to the ministries of agriculture. Some countries, it's conservation agencies, some countries on the environment. And the question, do they talk to each other? Because we keep encroaching into natural land. We're leaving wildlife less space. They're shedding pathogens. We are getting closer to wildlife. And this is just, this issue is really just continuing also in Europe. It's not somewhere in Brazil, it's also in Europe. And we do have a huge destruction of land surface, of wetlands, of oceans, and it's all coming back at the end of the day, affecting issues related to biodiversity. When we look at land use change in One Health, the land use change is the main driver of zoonotic diseases expansion. But I've seen recently in recent literature that this is also now, people start understanding that this is really shifting also towards also climate. So land use and climate, unfortunately, having the this honor of competing on this first place of who is really more affecting and creating zoonotic diseases. When it comes to climate and One Health, also we see lots of waterborne diseases because of rainfall. We see increase in temperature and foodborne diseases, growing populations of vectors. I mean, all those things that they were demonstrated previously by my colleague about climate change creates lots of changes, and also making the management of One Health, the interaction between livestock, animals, wild animals, crops also, by the way, environment and human health much more complex. So I would also pollution, and just to mention, also pollution is affecting, but I just mentioned that 6 tracks that were noted by the global One Health, the quadripartite, is, they have to do as what I mentioned before with zoonotic diseases, with tropical diseases, with food safety and AMR, but also they have a separate 6 track on environment. And there was a debate. Are we going to have a separate 6 track on environment? Because environment, I just told you, it affects everything. So the debate was, it actually affects everything. But if we are not going to have a special action track on environment, it will continue to be neglected and dismissed. So therefore, we have a separate track, which we are trying to work globally with member states on bringing the environmental people to the table when we talk about managing our livestock, wildlife, and human health. Obviously, the economic value need to be also introduced. I mentioned it in relation to green space, but it's in general because it's, nature provides us livelihood, reduce burden of health on healthcare system, but also brings intangible benefits of biodiversity in nature and humanity. In conclusion, and I have two more slides to go, we need to consider the dimensions of nature in decision making. It's not popular, it's tough, it's hard. The language is difficult, the interconnection and interdependencies are very tough to explain, but we need to do this job. And we need to do that at all levels, also from the national to regional to cities, and all across sectors. It's a global challenge, obviously. It requires multi-sectoral action, as I mentioned. It needs to coordinate, but sometimes not just to coordinate or collaborate, sometimes just enough to inform. And it goes on, and with data sharing, there are lots of complexities about that, but we need to work together better. And there is a broader understanding and commitment is needed to become that nature becomes part of the solution and not a problem. Just to summarize, and this is my last slide, I ask myself, and I ask also my colleagues in other member states, do we really understand and acknowledge the consequences of inaction? If we do nothing, do we understand what's going to happen? And it was very well demonstrated by my colleagues. And is the public sector, which we need to ask ourselves, is the public sector ready to tackle the triple crisis, including issues related like One Health, but also nature-based solutions and all those beautiful approaches that we want to use? Are we ready for that? Do we have the right skills? So, areas of action, I would say, may include, it's probably a partial list, and there can be more action, but at least integrated policies and commitments across sectors. Also to be able to deliver our international agreements and commitments like the Global Framework for Biodiversity and some other frameworks. We need to identify co-beneficial strategies and ways of working. And finally, the capacities and skills need to be revisited, utilizing tools and approaches like One Health, nature-based solution, impact assessments, etc., education and understanding data and evaluation. And my last sentence would be about the professional profile. The professional profiles for environment and health was visited last time 25 years ago. And this is an alarming thing, at least at the regional and the global level. So what we are doing right now as a project in the WHO office in Europe is also looking more deeply at the professional profiles, because 25 years ago, nobody talked about the triple crisis of biodiversity or climate. And now we are bringing all those issues and more into the table. So thank you so much.
Thank you so much. Merci. Merci beaucoup, Sinaya.
Thank you, Sinaya Netanyahu. Thank you to the translators who must have sped up and spoken faster than usual. It was fast, yet it was riveting. We will now have a small break. I think, we will now have 15 minutes for a Q&A. You can ask your questions. So mics will be handed out to you whenever you want to ask a question. I see hands being raised. And we also have questions online. Hello. Thank you. I'm Rika Manou. I'm working for a research cooperative that's called Research Partners. I have a question for Mrs. Netanyahu. But I'm interested in your opinion, if you have a different opinion, for people to behave in the right way, things should be simplified and to help them make the right decision. Let's simplify the environment, some people say. So I wonder if One Health simplifies or complexifies the environment. You're working on a way to reduce the complexity so that ultimately people can make a decision that is compliant.
Merci beaucoup pour cette question et je vais
Thank you for this question, and I will leave Sinaya Netanyahu answer. And if the two other speakers want to pick up, well, they're free to do so.
It's open. Okay, I think it's an excellent question because are we making it more complex with the One Health or not? And again, at the end of the day, One Health is an approach, it's a way of working, and there are 4 C's that we are trying to advance. One is communication, capacity building, collaboration, and coordination. But this is at the sectoral level. But now, actually, we need to simplify to the farmer, right? I mean, how the farmers would understand to work better when it comes to AMR, to antibiotics, for example. So I think that you're right. There is this phrase about translating knowledge and translating science. And we all as scientists need to do better and take the extra mile, translating it to policy, but also to action, but also to behavioral change. We need to understand behavior and cultural insights, and it will be different between one country to another. Because if you want to make an impact on a farmer in country, for example, in certain country in Central Asia, where any farmer can go to the shop and buy antibiotics, whereas in other countries it's not like that. It's more controlled maybe. Then maybe a different approach would be needed. So the behavioral and the cultural insights and understanding how the economic structure in each place, in each country, in each region, in each sector is very much needed. But, we should not, as a scientist, we need to do a little bit more and pay our due to the public and do a little bit more service in trying hard to communicate our science in an understandable way. We don't do that. In my previous capacity, I was a chief scientist at the Ministry of Environment in my country, Israel. And I remember I was also struggling, At the end, I was really pushing forward, the scientists. What is the message to the public? What can they do? What action they can take, or the sector, or whatever. It's an extra mile, and we need to be aware of it. Thanks for the question.
Merci beaucoup. Donc, effectivement,
Thank you. That's a true challenge to simplify messages, especially scientific messages. Are there any other questions in the room? And then we'll go back to online questions. I'm an epidemiologist at the École Normale Supérieure. We saw during the first 2 presentations that we had strong consensus on climate change and the impact it can have. It has already an impact on human population, and it will worsen. We have policies that are insufficient on climate crisis. We saw it with the emissions of greenhouse gases. We see also that with the recent agricultural crisis that we have a worsening situation and a political context where we should have other environmental worsening situations. So we are not in a favorable situation. We know that things are going to worsen and that it will impact the population. So my question is for all the panel, how should we position ourselves? How should we rethink our way of operating in this context as public health stakeholders, as independent scientists or independent agents, or as public service agents for the moderators? How do we rethink our positioning, our stance? That's a difficult question. Congratulations for being volunteer to answer. I can start on climate aspects. I've been working on climate change for 25 years, and for 25 years we are having ups and downs. Science challenged itself. There were members of the scientific communities, but also policymakers, NGOs, and we continued to explain as much as we could. We attended expert panels, we attended and worked with the IPCC. We have to continue working in all dimensions as a scientific researcher, as a committed scientist. There are many ways in which we can have an impact on society with science, expertise, a commitment as a citizen as well. And we need all these dimensions. There are more difficult moments, it's true. this period of time may not be in our favor and in the way in which our messages are conveyed and perceived, but we have to continue and do the same advocacy. Of course, this is events would support us, because what we've seen with the 2023 events, and I'm sure that this year it will repeat itself. And this helps us to be aware of how serious the situation is and maybe to speed up the political agenda. And we need to continue and carry on with what we've been doing so far. There's no other choice. Yep. On biodiversity, we are in a situation where our cultural representation places us much below what's happening in terms of climate, where the functional consequences and biodiversity are not understood by the general public. So we need to explain, and this is an issue, and it's difficult also to translate into straightforward decisions, nature-based solutions, where there could be co-benefits, and we have to insist upon co-benefits rather than on the constraints of such and such measures. Because otherwise we have a bad perception of the environment. We underestimate, we undervalue the movement of these bodies, the fact that we cannot stop carbon gases, and that's an important stake. It's an illusion to think that we would stop expansion of some species or their arrival via transport systems. We can do everything we can, but unfortunately we'll have to face consequences of such situations. That's the most stringent limit that I would see in terms of nature-based solutions. It's the fact that we have to make sure that the population admits, and some decision makers as well, they should understand that there are ecosystem situations that need to be accepted, and our leeway is modest.
I would add another angle into that, and I will share with you that last July we were called for an urgent meeting with one of our member states. The Minister of Health called for that meeting, and with our Director General, and he wanted. That was after his country suffered a major heat wave, and with some wildfires and some, and the reason why he called us, he didn't call us because climate change or vector-borne diseases. He mentioned both, by the way. He called us because he said, my workforce is not ready to tackle that. So it started to become very painful to the health sector. Health sector cannot overlook that. So then, the ministers already experiencing that. It was a summertime, and many of the doctors and the workforce, the staff, was on holidays, and they didn't expect that there will be a heat wave, and it was a touristic area, and suddenly lots of tourists came to the hospital and flooded the hospitals and the healthcare systems, and they didn't have the answer for that. They didn't even know what was going on, because you need to understand the implication of how it affects your body, etc., with all heat waves. So it started to become painful. So I think, unfortunately, until societies pay the price, we don't ask the right question: what can be changed upstream, not at the end of the day when everybody floods the hospitals and emergency rooms.
Merci beaucoup pour.
Thank you for these questions. I will read the questions that were asked online, and then I will let our panelists answer. Whatever answer you want to give to whichever question you want to answer. And then I'll give the mic to the room again. So we have the following questions. Very targeted question. Do we still have temperature records dating back to 2,000 years ago, or do we do simulations when we look at the temperature curves? A question that is very generic. Considering the scientific knowledge that we have from the IPCC and IPBES, why do policymakers do not take the necessary measures and actions that need to be implemented? Another targeted question: 3/4 of the population live in urban areas in Europe. Is it a public health issue to reconnect them with nature? What are the levers to motivate them to reconnect them with nature? Another question, how should we facilitate the implementation of intersectorial projects in France? We were talking about disciplines that are working in silo. How could we have a better integration of disciplines? How can we create bonds and connections between climatologists and epidemiologists and biodiversity and health, beyond the question of zoonotic diseases? How could we have a nexus between the three and not only 2 by 2, basically? And last question, which is very generic, how can we act without deeply challenging our lifestyles based on growth? These are the questions online. So you can pick up and answer whichever you want, and then I will turn towards the room and it will be finished because we have limited time ahead of us. I leave you the floor. You may guess which question I'm going to answer. Maybe the most straightforward question as to the reconstruction of past temperatures. No, we have no direct recording of past temperatures, but we have different methods that help us to reconstruct temperatures over the last centuries and 1,000 years, and even beyond with indirect methods that can help us to have some certainties. I will go talk about the last 2,000 years. We can have historic methods because we know when wine was reaped at the time, and we can have the temperature of summer sometimes, and that helps us to reconstruct temperatures. We have biochemicals as well with some isotopes in some trees, in some corals, in some seashells. We can reconstruct locally the temperature, and if we have a lot of points, we can reconstruct global temperatures. And we also have ice drillings that is being done also to reconstruct temperatures of sites. So the curve that I showed you over the last 2,000 years, it's an indirect reconstruction of temperature on top of what has been done over the last 150 years. Taking other questions, maybe? The other question that is a difficult question, that's action, solutions. We talked about growth and in decreasing greenhouse gas emissions. I'll try to see the glass half full and be more optimistic. For years, the UNFCCC, the policymakers have given some elements that should be looked upon in a positive way somewhat. When I started my career 20 years ago, the scenario which is said as to be business as usual is the red scenario, the one that would push us towards 4 and 5 degrees of increase of temperature. That's not the most probable. That's the one actually that I showed in the end, where emissions would stabilize, and that would bring us to 3%, 3 degrees of increase of temperature. That's too much, but that's less than what we were talking earlier on. Why? Because there are already climate policies in place where emissions are reducing, are decreasing. We can decouple economic growth and the fight against climate change. We have to go further, but there are some good news beyond the awareness raising, beyond forecasts. Behind the figures, we have some good news in terms of trajectories. The IPCC report says that resources are available for adjustment measures, for efficient measures, but also there are scenarios where we have technical solutions that exist today, and by 2030 we can reduce by half our emissions at the world level. We know how to do renewable energies. It's less expensive, but we have to move faster. So there are elements that would help us to be more optimistic when looking at the future. That's for these questions. Thank you. Yes, Philippe Grandcola, you have the floor. As to the public decision, it seems that the notion of co-benefit is not always factored in when it should be. For instance, when we think about the recent agricultural crisis, there are CNRS and atelier and workshops on how we can improve some yields without having an important impact. With rapeseed, for instance, there were in Val de Sèvres, there were some farmlands that were monitored, and the decision to go into that direction was not taken. Why? Because there's a bad understanding of what is at stake and the benefits that we would draw from this. Especially what the economists of the environment says is that we need to materialize the benefit on the environment. When you buy a product, then there's of course we have the production chain, but there's also the impact on the environment and water. And when we take into account all these benefits, including the benefit on health as well, there are somehow we could see that there are more constraints. However, we could see that some activities of production should not be viable. As for the environment, this is a very important subject, and this goes through urban experts. There's a lot of rural people that are not really connected. Maybe they do not have knowledge of the environment. They just live outside the urban areas. And so we need education. We need people to be acquainted with the environment. We need to have green areas, because going there helps to understand beyond the virtual representation in the media, on your phone and so on. It is indispensable education to get to know environment more. Biology has become optional, and this is actually a disaster. There are lots of initiatives that are being developed. There's an online training provided by CNED on biodiversity, where most of the teachers of junior high school could actually teach to children, to pupils. There's a lot of initiatives of mixed science, where people can take ownership of objectives related to the environment. This is important. These issues are important because we can understand what the issues are at the national level, regional level, or local level, and all the co-benefits that they can bring about, beyond the fact that we would not be able to satisfy our own needs or our own willingness to emit greenhouse gases. Thank you. So communication and understanding of co-benefits so as to facilitate decision-making, the decision-making process by public agents. Would you like to answer to some of the questions? Yes?
So, working together in the interdisciplinary and transdisciplinary intersectoral approach, and to break the silo, I think again, I agree definitely with my colleague on the fact that we do need to identify the co-benefits and monetize them to make sure that policymakers understand also the euro sign behind that, but also to identify the co-benefits. But I think that there is a lot of literature, lots of evidence out there, and we are still not there. So I would say this is not sufficient. What is really needed is probably for us to be very courageous and to develop lots of leadership in this area, and to make sure that there is no denial out there. There is no, because I was asking, do we really understand the implication of inactions? So we need also to very much understand the implication of inaction, communicate with policymakers, and then tell them, okay, but those are the benefits if we do act, or those are the potentials. And when we are looking at the benefits, the co-benefits, we need to, again, we want to be ambitious, but to be ambitious is very, very good and very nice, but also we need to be practical and to look for good, positive low-hanging fruit examples that we can demonstrate and show how we can work together on things like that. And on the urban area, yes, we do need climate-smart cities when we develop green space. I mean, in plenty places we saw, oh, they're planting trees, how nice. But then we figured that the canopy of the trees is so small that it doesn't provide shade. So what are we doing? Are we really cooling the city? Are we providing shade for walking? Because we want to increase walking. There was this question how we encourage health benefits out of that. Because green space, blue space within the city, they obviously promote physical health, they promote mental health, they are places where people can engage as with friends, so it has social benefits, etc. But we need to design it right, but also we need to make sure that we are not with nature-based solution, we are not increasing problem, for example, with allergies. So we need to plan the right things. So we need everybody around the table to produce good solutions, sustainable solution. And with the consumption production, yeah, look at SDG 12. I mean, we need to do better, all of us, each of us. Thanks.
Merci beaucoup. Je crois que malheureusement,
Thank you. Unfortunately, we'll have to stop here, otherwise the second part will never arrive. So I would like to thank Mr. Laurent Bob, Philippe Grandcola, Sanaya Netanyahu, and I will give the floor to Sébastien for the second part, for the moderation of the second part.
Les réponses à la dernière question font une transition parfaite.
Thank you, Sylvia. And actually, the answers to the last question are a perfect segue into what we're going to be talking about today. What are practical solutions? How can we use nature-based solutions and try and bring about co-benefits? I think it's very important if we want to find arguments also in terms of public health, as far as we're concerned here, in order to step up intersectoral solutions. So we're going to be joined by Alain Sandoz, who is a geographer. It's also very important science for public health. He's also the director of Science and Societal Interactions Department at the Aix-Marseille University. Alain is going to be talking about de-sealing and about vegetation projects. Hello, good morning, everybody. Thank you very much for this invitation. I'm going to be talking about a so-called action research project for the Aix-Marseille University sites in the south of France. Just to give you a bit of background, we have a lot of sites in our university. It's quite a large one. We have about 80,000 students, 10,000 members of staff, and about 54 sites and 5 large campuses. So that's dozens of hectares in surface area. And today we are going to be talking about de-sealing, the de-sealing of these sites. First of all, I'd like to describe this project. It's based on 2 levels. It's part of the European CARDIMED project. The objective is to find nature-based solutions, NBSs, that are adapted to climate change in the Mediterranean region. So a number of sites have been selected in that region. And in the Mediterranean region in France, 2 of our sites have been selected. The objective is to bring about a systemic transformation to adapt Mediterranean regions to climate in terms of resilience by using NBSs, nature-based solutions. Now, we have lots of partners, about 50 in this project, many universities, and we have demonstration sites in many different countries around the Mediterranean, in Spain, Portugal, Italy, Greece, Turkey as well, Slovenia as well, and in France. Now, we were talking about multidisciplinarity. So now if we move from the European level to the level where this work is being done at the Aix-Marseille University, one of the big priorities was to try and put together a multidisciplinary team from specialists in biology, environmental geosciences, chemistry, but not only life sciences. We also have people from social and human sciences, for example, cognitive ones, cognitive sciences, and environmental psychology. We also have people from scientific areas connected to health. But to start a research action project, you need to have partners amongst local decision makers. So we have a number of people, for example, in charge of public property assets. So lots of people are involved in this project. So we have 2 pilot campuses. And going forward, the objective will be to replicate these projects to other sites. So we have Saint-Jérôme, the Saint-Jérôme campus, which is in a peri-urban area, about 20 hectares in surface area, with 4,500 students. And we have another campus right in central Marseille, 4.6 hectares and about 6,000 students. Now, before we had this European dimension, we had already started a project with the Water Agency of the Rhone Mediterranean and Corsican region with a number of objectives. By desealing soils, we wanted to help rainwater infiltrate the soil. We wanted to vegetate these sites in order to develop biodiversity. We wanted to fight urban heat islands that resulted from devegetation and from sealing or land take, and of course to improve the living environment and well-being of users. Now we managed to secure funding from the Water Agency, and I'm actually coming back to some of the questions that were raised during the previous panel. The objective is not only to infiltrate rainwater locally and to develop biodiversity, we also want to generate economies of scale. If you infiltrate water locally, it means that, well, it depends on cities, of course, but if you don't have a separation between sewage and rainwater, if you infiltrate water locally, you don't have to expand your water network. So that means savings for local governments, but also savings in water treatment plants because you have less volume of water to treat. And that means less potential pollution issues downstream, which can have economic repercussions. So this was an opportunity to make a statement, to convey some ideas to decision makers by using or making an economic case. On these 2 pilot sites, we developed a number of scientific monitoring systems to take measurements before construction works or before works, and to monitor these sites for a number of years after the development on these 2 sites. Excuse me, says the speaker. We had a first phase. We want to deseal a number of hectares. We want 10,000 square meters, and we want to plant trees and shrubs, about 300, and we want to have about 1,500 cubic meters of water infiltrated or retained every year. Now, we have one campus where work is nearing completion. It's in Saint-Jérôme. More than 6,000 square meters have been desealed. We have a lot of measurement instruments there. I'll give you some examples later on. And we have a second campus, Saint-Charles. The objective by the end of 2025 is to deseal approximately 6,000 square meters. This is Saint-Jérôme. It's only part of the site. That's the area that was part of the phase 1 project, of the phase 1 de-sealing. So you can see the main building here, where we have the auditoriums. So we have installed many different instrument tools. Here I've particularly focused on temperature sensors. So you can see colored dots on the map. So we get temperature measurements before works. Temperatures will still be monitored for the duration of the European project, but we think that we'll keep monitoring these temperatures for another 10 years. So with these measurements, we can get information on temperature differences across on the same site at the same time in different locations, so depending on the location. And we'll monitor these temperatures after the development, after the project, after de-sealing and the vegetation of the site. We've also installed a number of sensors for particulates, but also for VOCs, volatile organic compounds. Just a brief aside here, if I may. We're particularly interested in VOCs because, as you may know, VOCs are released by plants and trees in diverse quantities, and the amount of VOCs can actually affect air quality because these VOCs are going to recombine with particles and increase the local pollution effect, particularly in urban environments. So it's very important to be able to monitor this. And it's also a very important variable we took into account when we selected trees and shrubs that were going to be planted in order to be able for us to monitor the effect of these VOCs with particles and the effect on air pollution. Now, the Saint-Jérôme site where works are nearing completion, one of the main objectives is to infiltrate part of rainwater into the soil. So we've developed some systems in the lower part of the site in order to have nearly 2 hectares of catchment area. And the objective is to make sure that absolutely no rainwater leaves this catchment area to go into the local network. So this is the map I showed you earlier on. As you can see, we've made a number of developments here. And like is done in many cities, we have what we call swales and infiltration pools in order to retain rainwater locally and help it infiltrate the soil. Now, this is a different angle. So this is really, big works. The Saint-Jérôme campus was built in the 1960s. So as you can imagine, roads were huge. There were lots of parking spaces. As this was on the outer city range, there was a lot of room. So a lot of land take with a lot of asphalt. Now we're doing the exact opposite. We are removing the asphalt areas that are unused or underused, and asphalt is now being replaced by vegetated areas. Now this is the current situation. Excuse me, says the speaker. I'm just looking for the laser. So you can see an area in more or less yellow or beige. This used to be a very wide road, but there had been absolutely no traffic in the last 20 years. So this is where most of rainwater will infiltrate the soil, and therefore it will not return or go to the local water network. You can see here the trees that have been planted, but of course you cannot see yet the final outcome. There will be a monitoring of this area in terms of temperature, VOCs, particles. We also monitor the soil permeability. We monitor trees and shrubs. We also monitor wildlife. I'm not going to dwell on this slide for too long, not getting into the detail, but on the St. Charles campus, which is a central, which is in central Marseille, we have a big issue here with the water table. This is an elevated site, but there are lots of communications between surface waters. Even though we have a lot of impermeable areas, sealed surfaces, still there are lots of transfers to the local water table. So there are lots of questions as to the transmission of pollution to water tables. So we're currently making a lot of measurements on the effects in terms of volume, but also on chemical pollution and microplastics pollution. This is to gather information and data, because of course de-sealing is a good thing, but by de-sealing the soil, are we not going to lead to the pollution of water tables? So we have a number of colleagues who are working on this. And we started this monitoring well before we started de-sealing. So this is the St. Charles campus. It's the first part that will be developed. It's the same objective as in Saint-Jérôme. We want to find rather downstream area where we can recover rainwater to infiltrate it locally on site in order to avoid having rainwater flowing into the network downstream. Now, there are a lot of connections here with health. I've already listed a few: air pollution, the pollution of water tables. So we are all aware of this, and we do some monitoring. But developing NBSs like that by using de-sealing has prompted us to think twice. Of course, it's great to restore the ecosystem or nature in cities, but there are risks, and we're aware of that, particularly if we create habitats that are favorable to vectors of zoonosis. There's a risk there, so we need to be aware of it. Very important. It's very important to bear this in mind. And our work will be to check whether these developments are going to change ecosystems and create habitats that may be favorable to some vectors. If so, in the design of solutions, we have to try and minimize any risks that could be related to the creation of habitats that would be friendly to such vectors and zoonoses. And it's not only about mosquitoes that can carry diseases, it's also about making sure it does not become a nuisance for the local community. Now, how will decision makers and politicians take up these NBSs and the repercussions on health? Well, we currently have someone who has started a doctoral thesis on how politicians and decision makers can embrace these solutions. So, as I was saying, a doctoral thesis was started in October 2023. And we're also working on the environmental psychology aspect of things, well-being. And in conclusion, that's kind of a summary of what I've said. NBSs, of course, have a link with effects on health. So, of course, we want to reduce ground temperatures through vegetation. For example, with the evaporative transpiration, we want to improve air quality. That means picking the right trees and plants. reducing the rejection of rainwater into the water mains or networks in order to relieve congestion or relieve water treatment plants, improve the well-being of users, and minimize the risk of zoonosis. Thank you very much. Thank you, Mr. Sandoz. Please join us. It's been a very, very practical illustration of this project. Now, I'd like to ask Mathieu Schuller and Laetitia Huard to join us on stage. They're from the ANSES and Public Health France, Santé Publique France. They're going to show us how both our agencies work together. So we have a framework agreement.
You have 15 minutes. Thank you. Thank you, Sébastien. Thank you. Hello, everyone. I'll try to make sure that you're interested, even though you're becoming hungry. We were talking about the conceptual part. After that, we went into the practical part, and we're going to tackle the middle ground, so to say. So we have two health agencies which report to different ministries. They've been working together for quite some time, beyond the One Health approach, and you can see how they can actually work together easily. There are 4 pillars that are shown in this presentation. Maybe we should start with the fact that we are scientific agencies. So we cannot analyze without having robust and solid facts to underpin our work. So we're going to have grassroots studies, surveys. We're going to look into chemical risk factors, for instance. We're going to look into a lot of parameters, contaminants in bodies. That's an important pillar. There's another one, which is very important for health agency, namely to monitor and look for pathogens, because they're very important in terms of health. They are transmissible, communicable. Chemical components are communicated easily, so we have to look into that. Everything that can go from animals to man, that draws our attention, and we have to be able to report it to public agencies if there's an emergency. We also need references for human pathogens and also references that are listed by the ANSES around all the animal diseases and anything that can affect plants. It is important to exercise each our remit, but to work also hand in hand in joint collaboration. Then we also are active in a wide array of public policies, as you can see: antibiotic resistance, health at work, and climate change. We each bring our input and insight in public policy shaping. It's a joint collaboration. We have a joint launching pad, for instance, for public health. ANSES, with its analysis of scientific literature, provides scientific landmarks that are worked then by Santé Publique France to make sure that this is integrated and then factored in public policies such as the National Nutrition and Health Program. It is important. If we have good data, if our surveys are accurate, if our assessments are correct, but our communication is void and not efficient, then we don't do anything. It will prove to be fruitless. So sometimes the information we have is accurate, but it is more complex, and it's hard to convey the message, and it's hard to be heard. It's hard to be factored in. It's hard to be understood. It's hard to have then pragmatic measures. So it's crucial to communicate in the right way. beyond the fact that we need to be rigorous in our reports. These 4 pillars are done relying upon some principles that we share. First of all is opening. We need to discuss with the beneficiaries and actors and everyone at stake. And so this is why we are the signatories of a charter with many different bodies and organizations. We work worldwide because pathogens know no border, obviously. So it is important for us to cooperate with others, to anticipate things that are happening in the neighboring country. We have to share data. Complementarity requires from us not to keep data for ourselves. There are some constraints, there are regulatory frameworks. We can't share data like this so easily, but we need to make sure that we need to foster synergy. And so we shouldn't work in silo. We have to communicate and we have to inform the general public. This is what we would do before. But that was before One Health. Let's tackle how One Health will help us and change. I'm not going to make a lecture on this, obviously, but the aim is to simultaneously consider issues associated with human health, animal health, environmental health, are considered together rather than in silos. For 3 reasons. First, because they go from the living environment in our bodies, in the environment, and they're fleeting, they move around. And so it is important to be aware of this passage, of this movement. And also it is important to observe populations, to see how it acts, and how this is integrated in a global ecosystem. And also, what is also important is to see what the first mission of the expert is, because often the grievances against the experts is that they didn't see it coming. So it is important when supporting public health policies not to underestimate the boomerang effects. This is what we didn't see coming, and this is also when we didn't see anything coming back with what goes around comes around, basically. And so it is important to prevent the boomerang effect. And there were operations like Mr. Jourdain, and then we went to a more specific joint operation like the One Health operation. This is the whole pathway. Those who know us know that they started before 2013, end of the years 2000. This is when we were facing with a huge problem, a pesticide, to destroy some pests affecting banana trees. It was maybe not the most concerning from the toxicological point of view if I compare that with the DDT or other phosphorus chemicals, then that agents that would be different. But it is a long term. And why? Because it was underestimated, and we saw its persistence in soils, even though the toxicity could not be the worst one in terms of scales, it would come back again and again. And this is why we needed to work together and to make population snapshots like in the Canaries. And we could then make a nexus with the risks to know what the levels are, to have a reference toxicological data, but also to get into a trend, a momentum whereby we would talk together, work hand in hand, not only on soils, but also not only in grassroots projects, but also conceptually and theoretically. This is why we managed to trigger scientific questions because we need to know if the situation is really serious or not. This is how we are challenged in our joint work. That is actually an important trigger, because we could see how difficult it could be to understand and understand that scientific work is slow, that analysis is not as swift as we would like, and the schedule and timeline are subject to expectations that are understandable, especially against a historic backdrop that is very specific. So we mobilized the know-how of our two agencies, and we're going back and forth with what we could understand from the observation phase and the risks that are understood to get closer to a solution and see what the real challenges on the fields are. And this is to prevent the boomerang effect, because we know that we could have this boomerang effect not only in the Antilles but also elsewhere. You also have the zoonosis. We talked about the fact that viruses are present and that they participate to. They are part and parcel of the problem at stake. So we're going to tackle this under the One Health angle. We have human health on the one hand, we have animal health on the other hand, and we try to look into all the specific features of each, and we'll try to do passive observation. Doctors are invited to register cases of diseases. Then in the cattle raising field, we see who's contaminated, because it goes from the wildlife to animals. We've had 2 difficult years in terms of animal raising, and with the ducks in the southeast of France. These are the 2 systems that are quite well managed. But what we thought with Santé Publique France is that if we remained passive, we would miss something. We would miss a train, basically. And this has been said earlier. They are not static, these viruses. It's not that they don't move. They move around, definitely. This is actually enabled by different means, but they evolve, they develop. And this is why we proposed and set up a mechanism to capture the critical moments, the crucial moments. I'm not an expert in virology, but that's when they mutate. Every time they go from one species to another, that's when actually it is important, when they go from the duck to a cat or a pig or whatever. We need to identify whether the virus has mutated to change its specific features, its specifications, to become something that is more zoonotic. So, hence the importance of having a lively discussion with all the agencies that are stakeholders, and to have discussions also, open bridges between the human health agencies and animal health agencies, so we don't wait and see until the crisis hits the roads and the rubber hits the roads, basically. So we need the 2 agencies to work hand in hand to have a One Health approach. And I'm going to give the floor to Laetitia to carry on with other examples. Thank you, Mathieu. Hello, everyone. I will try to speak about 2 examples. One that is less usual when we think about One Health. We always have the infectious issue in mind. I would like to talk about the Albane project. We've been working since 2021. It is a volunteer-based project. It's a survey that we built together, the 2 agencies together. and it relies upon a long history of bio-monitoring, health, nutrition, and environment, and it draws upon previous surveys that were carried out by Santé Publique and France and ANSES between 2014 and 2016, and INCA for biomonitoring and health and nutrition. So when we wanted to renew the data and the knowledge indicators, what was at stake was to pool resources so that we could have one single survey that would measure all these parameters so we could better understand the exposures to health risk factors, and it was important to have a common mechanism. In this survey, we saw that they relied upon data coming from the nutrition realm, because the dedicated nutrition agency highlighted these issues, but also health and environment with the setting up of a biomonitoring mechanism that would be more long-term. These studies allow us to have a wide panel of data. This is the interest and the challenge of that type of survey, because that would lead to first challenges related to working together. We need to understand the disciplines, how we all work. And we can see this continuum between biomonitoring, nutrition, food, and health. We see how these exposure to risk factors will impact our health, but also our behaviors, because our behavior will make us being more exposed to these risk factors. So in terms of organization, we need to reorganize ourselves, and we wanted to be more ambitious and to challenge the way in which we worked. This helped us to change the way we would conduct surveys. Instead of having data every 10 years, because we would launch a very big survey that would mobilize a lot of resources, we decided to be more agile with cycles that would work on samples that would allow us to adjust ourselves in a more agile way, with emerging and to understand emerging indicators, to have more consistent and more relevant data, and to have finer information to improve our advocacy for the improvement of nutrition and the agro-systems upstream. This is the information that we shared. And to talk about what we've done so far, I would like to speak about a monitoring system that was set up during the COVID epidemics, namely wastewater monitoring, that was done first by researchers, but also the public health agencies such as Santé Publique France and ANSES for to detect the emergence of infectious diseases. We worked in an environment that was initially unknown by Santé Publique France, wastewater. And from wastewater data, we could have an estimate of the circulation of the virus on the territory. And this is very disruptive in the way we worked for monitoring purposes, because we didn't have the systems to follow human health for infectious diseases. And that actually completely changed the way in which we approach human health. This monitoring system is one of the only lessons learned from the COVID crisis. I'm speaking under the supervision of Mathieu, but I'm not sure that there was a One Health approach to this epidemic at first. This is a legacy from this crisis that helped us to shape the One Health approach, and also it helped us to learn that borders did not exist on the whole planet, basically. That's one of the important learnings of this crisis. We can see that this is very important, that it's linked to the moving of pathogens. And for the preparation of the future crisis, it's important to understand that all the different environments are complementary, and we need to understand in each realm the risks that could affect human health everywhere. There's also something else that is really important, is to improve information, communication. We could see what has been done in terms of advocacy and drivers of communications that can be very important in that field. As an agency, we want to reinforce this One Health approach in our collaboration, and that is done seamlessly with discussions with the different agencies on different subjects. We need to make it systematic, to make sure that it is very tangible, very concrete, the way in which we think about infectious diseases, the way in which they can have an impact on human health. This is really important. We need also to think about beyond the impact that it can have in terms of health, but we need to see how we can incorporate health-enhancing environments, the benefits that we can reap from that, from the secondary effects. One Health should not be summed up with ANSES and Santé Publique France. We just joined up because we thought that it was a good idea, but we should extend it to other agencies that would have other remits and that are essential to tackle this issue, to have data from multiple dimensions and to have a global reflection on the matter. And I'm going to give the floor now to my colleague. Thank you, Laetitia. You've given us your input on the logistics, the organization, the concept, and on the way we should act. And One Health is an invitation to working in a systemic way. When that means that we have to systemize our way of working, our collaboration, beyond the fact that there are decrees and texts of law that give us the impetus and tells us what to do. We have to see what the others are doing. We have to work early enough to move faster and go further together. Another subject looking forward that is important.
Expertise, quelle qu'elle soit, c'est on n'a pas beaucoup de données ou on n'en a pas assez.
Often, the conclusion that is being drawn by a lot of experts is that we are lacking data and that we have insufficient data. Maybe there's something that we do not use enough at the crossroads of data. If we take the time to analyze all the data and to cross-reference them with other data sets, we could have some additional information. Before collecting more data, we have a system that is well organized, that is the CDS, and we need to complement each other, maybe to have additional information on environmental data. And the green data for health, and that's the National Environmental Plan, however it has an English name. And when we talk about cross-referencing, it's not only a matter of data, but also professional inputs. That's one of the important teachings. We should work with epidemiologists, virologists, doctors, and so on, professionals, and to see how our specific languages could be cross-referenced and how we could implement recommendations. We could take ownership of these recommendations. And maybe when we want to have a global approach, what is lacking is some skills that we do not yet have. Some of them are around the table, for instance. We need people, experts in geography, for instance, for example. So we need to expand the way in which we approach the One Health concept. Thank you for your attention. And I'll be delighted to discuss with you and have a Q&A session. Thank you. Thank you, Laetitia and Mathieu, for this presentation of the agencies that echoes to what sessions that already have taken place this morning. It's 12:30, but we're going to have a Q&A session for 10 minutes so that we can have some time for Q&A and a conclusion by Sylvie. Do we have any questions? Yes, we have the gentleman in the back. He seems very excited to ask his question, and so we're very excited to listen to that gentleman as well. Please introduce yourself. My name is Christophe Lerin. I'm the Deputy Director of Santé Publique Research in Rennes, and I thought that it was very inspiring, this session. So I wondered, every time we tackle a public health issue, may it be One Health or other issues, when we talk about big transitions, may it be in health, environment, or digital subjects, how do we manage to take on both three essential stakeholders: the world of research, decision-making realm, may it be decision makers or the big public authorities, and NGOs and citizens that are fully engaged? We have mapped territories for the society. How can agencies work with Mesri on that subject? How can we experiment that? Just a small example, and then I will be silent. In Rennes, we are experimenting these works. We ask the three stakeholders to bring their input to research, may it be on environmental issues, but also on water stress. And we try to ask the opinion of decision makers, researchers, academics, and we also ask the young population to involve themselves in issues related to rural areas, everything that is important right now, that is high on the agenda. For instance, in Marseille, it was wonderful what you were talking about with at the campus level, and we should draw upon and follow your model. So you managed to have decision makers on your side to co-build these experiments. They're very interesting in terms of transition. Thank you for your question. That is essential. I'll answer straight away. Oh, I'll take all the questions and then we'll answer together, all of them together. Thank you. Thank you for this beautiful presentation, Yves Scherbag. I'm a public health doctor, but I'm also an elected representative from Santé Publique and Territoire Network. I would like to share an anecdote with you and ask a question. 2-3 years ago, we received an opinion from the prefecture, saying that the H1N1 virus is spreading, that we should do something about it and have all the chickens in. And there was no specific precautions as to people handling birds, poultry that would be dead on the territory. So I wondered, and I looked up some international websites. H1N1 had some human cases in China. And I really was confused and I wanted to know more. What about the message from the prefect? Why don't we suggest recommendations as to people handling dead birds, municipal agents, hunters in situations such as this one? Thank you. If we go back to the first question, Mathieu, maybe you want to answer? Indeed, it's not easy. How could we mobilize people around these issues, even among researchers, research scientists. I try to be as honest as possible. At first, we had a project that was supported by the Water Agency that allowed us to have some momentum and contact people and research scientists from other disciplines, but also territorial authorities, and to ask them to give their input in a reflection. We had a steering committee on desilting, for instance, for the region of Aix-Marseille, and we saw that there was a common interest. Everybody would find their interest on this issue and their stakes that we would share. And then we had a domino effect with this project because we were then contacted to participate in a bigger European project. That helped because other actors, other stakeholders were contacted. I think that funding, the possibility to fund studies is also helpful because we had money to fund works from research scientists, but also local elected representatives and political representatives. That helps to make sure that we have the necessary impetus to carry out the study and work together. This helps to have the right motivation. It took 3 years to have the right synergy and dynamism. Because at first there was not a strong motivation among research scientists and decision makers, but afterwards they take ownership of the project. We talked about the cognitive part when we actually tested it on at grassroots level. They took ownership of the project when they saw how interesting it could be, the interest it could have for themselves, and the fact that it was a cross-cutting endeavor with converging interests, not each one of us in our silos. So there was a real synergy, a multidisciplinarity, where the objectives of each and everyone would converge, but it was not easy at all. Thank you. Laetitia, would you like to say something? One sentence. Made me think about one thing. I grew up in a pluridisciplinary team. It was helped, but afterwards, because it was my first team, I didn't understand at first how important it was. When I hear you all, I can see how important it is to listen to others, to understand the drivers and the constraints, to be humble, to work as a group, to be a family in a way. It's the same thing as the multidisciplinary research. Other some food for thought as well. I agree with you. When we talk about risk governance, it's as a matter of general matter. It's not science should not dictate what should be done and the others would follow. No. Short channels are the best. Namely, when we manage to convince that there are risk factors, that there are positive behaviors, some behaviors that are less positive, we need to convey the right message. What do we do already at the agency, at the ANSES? We have a board of directors where all stakeholders are represented. And we also have special topical committees with, we work with trade unions, tackling agricultural and farmland matters, or works working population or others. And we set up dialogue committees where we try to share our answers, and something else that is more important, the questions that we ask ourselves. Because when a scientific researcher asks a question to himself or herself, it's not the same thing as a question being asked by other people. So we have to ask ourselves the right questions before finding the answers. So it's very important that we should find the right pathways. And same thing for SEER, for your agency, for grassroots issues. And I will wrap up to talk about H1N1. So when we have to tackle the issue relating to ducks and poultry, the problem is that there was it wasn't tackled simultaneously with the other illnesses. And One Health should have been implemented at the time. It would have been very important to do so because it was a hurdle. The virus could multiply, the virus could easily be transmitted to and communicated to other species, and it could then mutate in a genetic combination that would impact us. So I agree with what you're saying. It is important for the message to be conveyed and disseminated to everyone simultaneously. So we shouldn't work in silos. We shouldn't separate the diseases, because what is at stake is the protection of human population, animal population, and interactions between the two. To pick up, because you use the acronym of regional cells, that's what is meant by the acronym SEER. And so we work on land-based projects, but also sea-based projects for health-related issues. We try to capture everything that is taking place on the territory, but also we try to assist decision makers and try to give our insight. Thank you. We were also talking about labor at work earlier. I think it's important to think about health in an occupational environment. So I would like to thank all the speakers that spoke this morning. We should applaud them. And a few minutes for conclusion. Sylvie, I'm sorry, I'm actually preventing you from getting lunch, but I would like to talk about a few teachings from this morning. What we could say is that we need to have a better understanding of the subject matter, interactions of the three types of health. We are not all crystal clear on the matter. And this requires from us to have a better dialogue between the research scientists on the three subject matters. We need to have better communication on our findings. That is important in many places, not only for those working on environment, but also on farming, management, municipal management. So we need a full-fledged training on the subject. What we also need is to understand, for the prefect, for instance, he needs to understand what is at stake. So we need to have simple, straightforward messages that can be understood by each and everyone at all levels. And then we need communication on co-benefits of solutions that exist. It's not that they do not exist, but sometimes they're not understood. So that's an important point that we require economists to be taken on board. We have real subjects, real issues relating to prices and costs. And the penultimate point, how can we scale up flagship projects We talked about the desilting project of soils, how we can scale up afterwards in a town, but also in all cities. How can we convince and take on board all research scientists, public decision makers, and citizens? That would be helpful to understand and scale up from the get-go such research projects for the implementation of solutions. And then we need to change professional practices, to cross-reference data, to have a multidisciplinary approach, to talk with people that are not our usual contact partners, to go out of our comfort zone with citizens, with other people. And that's maybe something that we haven't learned to do. And we tend to work in silos. So that's a few takeaway messages. I would like to thank all the speakers, those that have organized the session on behalf of Santé Publique France, Lucien Godard, Jean Godard, Laetitia Perrin. I would like to thank the interpreters and all of you for your attention, participation, and interest. There are two other sessions taking place afterwards. There's one session on the ramping up of zoonosis that took place on Thursday, but we have a podcast that is available and a session that is taking place this afternoon with the evolution and adaptation of epidemiological surveillance methods, and I would urge you to attend them. I wish you a wonderful lunch. Thank you.